wānui uri noa tō tātou nei maunga tēnei te mihi atu ki a koutou katoa no mai oki mai ki te wā pārika ki te pautūtanga o te rā. And of course with me today I'm very privileged and honoured to be able to talk to some of our frontline workers at the Ngāruahine Iwi Authority. They've been around the communities for the last 2 weeks testing our iwi, looking after our iwi. And again, it is my privilege to have these beautiful ladies joining us today. And of course, I'm going to pass the po over to our ladies to introduce themselves. Nō reira, we'll start with you, Lola. Kei a koe te wā.
Nā koe, Kamdai.
Kia ora. Tell us what your mahi is at Ngāruahine.
He kai hapai, hana ura kai hapai, uplifting whānaus in times of need for assistance. I mainly work with the kaumātua though, doing kaumātua activities and teaching their day all good and teaching licenses. I like working with the rangatahi.
Ka pai. Next.
Kia ora, ko Michelle Kahui ke toku ingoa, tapu mahi e koutou toko. So I, as well as kai hapai, and supporting whānau alongside with referrals from GPs, even self-referrals throughout the area of whakahurangi, Arakamu and also Hawara area. And we also do the coastal area as well, including Manaia, and just supporting our whānau along with their well-being.
Ka pai. And last but not least, we come over to our last kai kōrero.
Kia ora koutou, ko Mel Maltanaho. I am a kai mahi, kai hapai and mental health. I run a mental wellness peer support group in Hawara Monday afternoons, and do daily living activities with my my clients.
Nō reira, mai te korimako o Taranaki e mihi atu nei ki a koutou. So since COVID lockdown, when we got the call that we were going back into level 4, right up until now, you've been doing some wonderful work around the communities, keeping them safe. Lola, I'll come to you first. Tell us what's that been like for you guys on the front line?
Well, I suppose depending what position you're doing, what money you're doing on the front line. I know I'm just, like I said, I'm doing the parking, the vehicles and that, so I'm loving it. Yeah, I enjoy working and seeing people. I'd rather be doing this than staying home on lockdown, I'll tell you that much, guys.
Kia ora. Tēnā koe Lola, and I'm sure that you keep our people happy while they're waiting in the car park.
I don't know about that part, but I'm trying my best.
Ka pai. Nō reira, Michelle, part of your job since you've been with the crew for this level 4 lockdown, what's that been like for you?
It's been fantastic, just seeing the support from the community that have come through our pop-up clinics. So my mahi was actually going to the cars and getting the info, and just making that conversation and keeping them, you know, in a good spirit.
Yeah,
that's what I love.
What are some of those questions that come across from our people that turn up at the car park? They must be related.
Yeah, there've been a lot that have come that have been in Auckland around that certain time around CBD, and so those are all noted onto their sheet, and it makes it even faster when we do have a good big crowd, that the people come with their NHI number, so that saves a lot of time, and yeah, but the people have been really welcoming. You know, their communication have been fantastic.
Ka pai. And Mel, coming to you, what's your role here in the lockdown when you're doing the testing at the stations?
So my role is I'm writing on the vials, and putting the information into the packs and putting them into the chili bin. So that's my
Now
process.
that's interesting, because I've been for a test myself, not now, but in the last COVID lockdown, I went for a test. And what's the response that you get when do you put it up the nose, or what do you do? Do you swab the mouth or?
Warren swabs them through the nose, up the nasal passage.
Mm-hmm.
Yeah, he's really awesome.
And have you had good responses from that, or
Yeah, we have.
what responses have you had? Yeah.
He's made everyone feel real comfortable.
Kahui. It's really wonderful thing.
No one leaves swearing and abusing us afterwards, so that's the main thing.
I suppose, Lols, that's what I'm sort of looking at, because is it really family that you're dealing with, or is it, other people outside of the family that are coming to the testing stations as well?
All sorts. Yeah. All nationalities.
All nationalities.
Yeah.
So
all ages.
Yeah. So in those times, how do you keep yourself safe?
Well, in my job, I've got a loud voice. I'm all good. I stay way back from the car and just yell, that way, please, that way, please. I'm nice and safe.
Oh, that's so fun. Oh, just wonderful. Just absolutely wonderful.
I think it's how that I've been with a few cars, had a few conversations and a lot of laughs too, which helps keep them at, at ease. Yeah.
Oh, wonderful. That's absolutely wonderful.
We have.
So, staying with you, Michelle, looking at the numbers that have gone through the testing stations, if you could give us a guess on how many you've had through the testing stations.
Well, so it depends on the area. Whakahuranga has been the highest. That was last Thursday, 57. So we hadn't even set up or arrived yet, and the car park was full.
Wow.
But then it didn't take long for us to set up, and we just went through them, and fantastic, driving force throughout our team, and we've been just so that togetherness and onto it, and it's been fantastic with the areas that we're in. It just flows.
So tell us the places that you've been to, Mel, in the last 2 weeks.
Oh, we've done a couple of Manaia, Kaponga, Opunake, Okato. Yesterday back in Whakahurangi, and today we're at Eltham today at the Kohanga Reo, if anyone wants to come in, till 1 o'clock.
Till 1 o'clock. Wow. Absolutely wonderful. Ladies, really is. And it's a privilege to be able to talk to you guys, because this time around, we had the force of our iwi there, but really the health workers are the guys, you guys are the ones that have been carrying the load, and with the variant being the way that it is, it's been quite tough, for a lot of people just to, we all, it's not normal anymore, but, for yourselves, you go home after you've finished your mahi, how do you relax?
Kai helps.
Kai coffee. TV, sleep.
And just being back with at home.
Yeah.
How's the rest of? How's your families? How's your partners doing?
Roman hasn't been home yet. My child has a rumor and he thinks that maybe he thinks lockdown means stay off his phone too. I don't know.
So does Bossy make your lunch for you, Michelle?
Well, he made me breakfast this morning before I came, so that was good. It was like a drive-through McDonald's. Hash brown. Oh, sorry.
So does he give you a bit of a sing-song on before you leave?
I hear it on your Te Kore Mako jingle.
Oh,
I said,
lovely.
"Oh, there we go. Because I know you
Absolutely
spoke
lovely.
about it. It's awesome to hear.
So
Yeah.
how long are you going to be testing for? Is this going to go on, even after we come out of the lockdowns?
Probably. We if people do have signs or symptoms, we do go and do bubble tests. So we go into their bubble and do bubble tests.
Okay. So coming back to you, Lola, you're looking after our kaumātua and kuia out there. So how have they been? Are some of them living on their own, or they've got family around them?
No. Some are still on their own. Some are still not listening. No, their assumption is they're all good. Like I said, we've also got another staff member who's doing phone calls, regular phone calls, keeping an eye on them too, sort of thing. I think the most worry is making sure that they're all up to date with their medications. We've had a couple already to bring us the other day that they're on their last tablet. So times like this, trying to get them into the doctors or get more prescriptions. But yeah, touch wood, they all okay. They all.
So how's our rangatahi been? How's our rangatahi been?
Well, no news is good news. How's that? Hopefully taking the bubble thing seriously. Hopefully, yeah.
So you're looking forward to getting the vaccine rollout?
I'll take Mel on that question.
Yeah, why not? On Sunday in Hawera, we've got an essential workers vaccine rollout.
Yes.
From 10, is it? Oh, yeah. No, it's later than that. I don't even know what the time is now. 10 to 4. Yeah. And, if any essential workers out there that need the vaccinations, to ring the 0800 number. But yeah, sometimes, some of us are still half and half. Do we vaccinate? Don't we? But we're all vaccinated.
Yeah, ki taku nei Wakaro, I think you should, because you're out there on the front line. Koina taku. So last words, ladies. I know I'm taking up your time and you need to get back out there in the car park. Just last words, what do you want to say to our people, to our all of our iwi? Kei a koutou te wā. So I'll leave the last words up to you guys.
Take it seriously. Keep within your bubble. Keep warm, keep safe, keep at home.
Take care out there, whānau.
Okay. Kia ora. Kia ora. It's been a privilege talking to you, like I said, this morning, to have some of our frontline workers on here at Te Kore Mako o Taranaki. We all love you. We all send hugs and kisses and hongi to you through virtual, but ko te ngākau ke te kōrero. No reira mihi kawana ki a koutou katoa, and it's been just absolutely wonderful talking to you all. I'm speaking with our ladies from Ngāruahine Iwi Health Authority, being out there on the front line for the last 2 weeks, taking tests and being all over the south of Taranaki, and just have to take our, mihi to you all. Kia ora.
Kia ora. Pai tora.
Ai, kia ora.